Hello, my name is Ethan Levin. I wanted to record this video to give you an idea of a day in the life as an equine and livestock technician at Adobe Veterinary Center. On a typical morning to prepare for my day, I will pack a lunch for the day in my quite large lunchbox, putting in both options for being out in the field and also being in the clinic. So this is some leftover chili from last night, and this is a sandwich. So if we don't make it back to the clinic for lunch, I have a sandwich to eat in the field. I'll also usually head to the freezer and grab an ice pack that's gonna keep my food, my cold food, cold throughout the day. I might also add things like granola bars, fruit, and such. I'll also usually grab out my notebook and my pens for the day, and I will stick those in my pocket. And that way when I get to work, I've got my notebook, I've got my pen, and I'm ready to go. And that's Domino. My lunchbox / travel bag, whatever you want to call it, is also equipped with some sunscreen because it's getting hot and sunny out there. And I also always bring a very large full water bottle for the day to stay hydrated. We're on our way to the clinic right now, and I live about 10 minutes away. This is just the tail end of my drive. It's rather beautiful out, and I just wanted to show this. So we've arrived here at Adobe on the northeastern side of town, off of Tonka Verde Road, and I'm approaching the clinic. Today I'm going to show you around the clinic a little bit and also give you an example of a procedure that we might do on a typical day on the large animal side here at Adobe. As I mentioned before, Adobe is a mixed animal practice, so we also have a small animal side to the practice that I'm not going to show you much about. I'm going to focus on showing you the equine and livestock facilities here at the clinic, and I'm also going to show you a little bit about our ambulatory units or our vet trucks that we take out to clients' homes or in the field. Here is the lab station, and this is our x-ray room where we will work on pigs and goats. Obviously, horses and cattle are going to be too large to fit on that small little table. And here's our surgical prep area with things like sterile gowns, sterile instrument packs, suture, and other surgical equipment. And this is the barn. This is where we will do our common large animal procedures. You'll see the computer there. These are 3 stalls down to the left-hand side here. We have 1 hospitalized pig in clinic today, and that guy is just chilling there. And this is our medication cabinet for our pigs. We work with Ironwood Pig Sanctuary, which is a rescue up in Marana, Arizona, and we take care of a lot of their pigs when they get sick or injured, and we will keep them here in the barn stall until we get them feeling better. Now we will head outside, and I will show you one of the ambulatory units or mobile vet trucks that is stocked to the gills so that it is self-sufficient in the field when we head out to clients' homes and treat their animals, whatever that may look like. These trucks are really awesome and literally a clinic on wheels, giving us everything we need to be successful and provide us with all of the resources and equipment we need to get the job done. And here you can see one of our trucks. And this is the cord that gives it power at the clinic. And back here we've got the bed with our 4 main drawers. And in this bottom right-hand drawer here that I'm going to pull out, we have some dental equipment. We've got a speculum, stainless steel buckets that we fill with water. The float is in that black box. Here we've got dental instruments, cotton rolls, hoof materials. Over on this side, we've got our caddy with our stethoscope, thermometers, lube, cleaning solutions, antiseptics, eye box, bandage box, things like that. Up top, we've got all the injectable stuff, syringes, needles, injectable medications, things like that. And then over here we have our ointments and creams and things that we'll put on wounds, eye wash, things like that. And over here is just the trash container and the sharps container. And then moving back over here, one thing I wanted to point out is on the edges here, we have our nasogastric tubes that we will give fluids down horse's nose and into their stomach to provide more hydration. And then over here we have our pharmacy. This is where we can get out medications that we script to clients when we're in the field. And then this is our refrigerator. And we have an inverter that runs this fridge. It's got injectable meds, vaccines, things like that. And up top, we even have a freezer. And this is the treats and the lead ropes. And here we have our hose with our running water and colic hand pump. We've also got here some chlorhexidine solution, mineral oil, lube, things of that nature, a big syringe. And then over here we've got our lab. We've got lab blood tubes, we've got certain tests that we can run in the field. And here we have our cold sterile in this red container, suture, gloves, catheter box here that I'm getting out, and other sterile equipment over here. And then down here we have our fluids, our electrolytes, our headstand is that green thing there. Those red things are our roundup boards. We got a rope if we need to catch any animals. Those boxes have fluids in them. As a technician, it is my job to keep the trucks clean, organized, and stocked for the person on the shifts the following day. And it's just important that I look at my schedule when I start the day and make sure I have everything on that truck that I need, and we're not going to be short of supplies when we go to a call. Now we're going to head back to the barn, and Dr. Edge is going to perform a mass removal on the inside of this horse's eye. This horse has squamous cell carcinoma, and she's going to remove the mass and also perform freeze-thaw cycles with cryotherapy in order to kill any cancerous cells that remain. And then the horse should be feeling much better and be a lot more comfortable after healing and recovering from this procedure. As you can see in this picture, this horse has a large pink mass inside of its eyelid, and our doctor is going to remove that mass with the help of her technician and a vet student. After a discussion with the owner and a thorough exam of the horse, she's going to sedate the horse with an IV injection. And you can see her here poking the horse. And it's going to take a couple of minutes, and the horse is going to begin to get very sleepy. Since this horse is also pretty uncomfortable, the doctor's going to give an IV injection of a pain medication known as Bute, or phenylbutazone to be more specific. She'll then secure the horse in the stocks to allow the horse to lean back and forth on those bars. This helps to secure the horse from falling while sedated so that the doctor can operate. Now that the sedation has kicked in and the horse is more comfortable, she is cleaning the area, and she's going to poke that area with a needle to numb the area for operation. Here you can see her preparing to numb the eye with lidocaine, and here she's injecting the lidocaine, and this is going to allow the horse to not feel anything when she actually begins cutting the mass out of that eyelid. This process is pretty uncomfortable for the horse, as you can see.
Beautiful. And I'm just going to gently
After giving that eye just a little bit of time to numb, she actually begins cutting here, removing the mass with
I
some
just
sterile
want you
scissors.
to know that I know that it's going to
And you can
bleed
see her
like the
cutting there.
Dickens. It's less scary.
While the
when
vet
I
student
tell you
assists
first.
by holding the mass out from the eyelid with some thumb forceps.
Okay.
Having removed the visible cells, the doctor begins cryotherapy with liquid nitrogen, going after those cancerous cells that can't be seen with the naked eye. And you can see the vet student there assisting, holding a piece of foam over the eye to protect the eye itself while the doctor freeze thaws those cancerous cells. Here's a picture of the eye after the procedure, and you can see that the mass is gone. There is still some residual swelling, but with a little bit of time and some meds, the horse will make a full recovery. Everything went great. My responsibilities at Adobe involve prepping for, setting up, assisting with, and cleaning after procedures just like that one. As a technician, I am also responsible for taking good notes to type detailed medical records describing procedures and treatment plans managed by the veterinarians. I also prepare invoices and collect payments for services rendered by Adobe. The veterinarians at the practice are incredibly knowledgeable and skilled healthcare professionals, competent in a vast variety of preventative care and emergency procedures across numerous livestock species. A job as a tech can be very challenging and even stressful at times, but it is so exciting and completely worthwhile, as no day on the job is boring or the same. I am blessed to have had this opportunity to work with such a wonderful team and would highly recommend this experience or similar experience to anyone. I've learned so much from this experience and am excited to one day be a leader in a team as a veterinarian like those at Adobe. I hope you enjoyed tagging along with me for a day in the life as a large animal technician at Adobe Veterinary Center. Thank you so much for watching.